Stop memorizing hepatitis viruses one by one, use this instead. Hi everyone, it's Miss Jem guiding you on your pharmacy journey, and today, tuturuan ko kayo kung paano mamememorize ang characteristics ng hepatitis viruses using these patterns. So if you're ready, let's go! And for this video, we will compare hepatitis A, B, C, D, and E. And we will compare them based on their basic characteristics. Let's look at this. First, the genetic material. As you can see, all the hepatitis viruses are RNA viruses except hepatitis B. B sounds like D, and hepatitis B is a DNA virus. Next, we have the envelopes. As you can see, the vowel letters, hepatitis A and hepatitis E, are non-enveloped viruses. And then hepatitis B, C, and D, which are consonant letters, they are enveloped. So let's think of it as the consonants were coats. Now for the transmission, as you can see, we have the same patterns. Hepatitis A and E, which are vowel letters, they can be transmitted through fecal-oral transmission. And then the consonant ones, hepatitis B, C, and D, can be transmitted through blood, sexual, and parenteral transmissions. And to further understand and memorize this transmission or spread, we will use a mnemonic using their letters. Hepatitis A is for anus because, again, A spreads from fecal-oral route. That means it can be obtained through ingestion of contaminated food or water with feces, maybe through poor sanitation, unsafe handling, or contact. Hepatitis B, we will use the mnemonic starts with B, blood, body fluids, and baby. Hepatitis B can be transmitted through blood and body fluids. This includes sexual contact, sharing needles, blood transfusion, and vertical transmission from mother to baby. And for hepatitis C, C stands for circulation. Hepatitis C is basically blood-borne, meaning it spreads through direct blood exposure. It means that it can be obtained from unsafe injections, sharing of needles, or contaminated medical equipment. Next is hepatitis D, and we will use dependent on B. Hepatitis D cannot replicate itself. Rather, it requires hepatitis B to replicate because it uses the hepatitis B surface antigen. So it means a person will only get hepatitis D if hepatitis B is present. And last one, hepatitis E, we will use letter E, enteric, because hepatitis E can be also transmitted through fecal-oral transmission. And when it comes to the risk of chronic infection, we will use the same shortcut, the vowels. Hepatitis A and E is less likely to be at risk of chronic infection. They are usually acute. However, hepatitis B, C, and D are the ones that are at risk of chronic infection. And for the vaccines, hepatitis A and B vaccines are available. There's also an available hepatitis E. However, it has a limited availability, and the vaccines for hepatitis C and D are not available. And just like that, you have understood and memorized the different characteristics of the hepatitis viruses. Save this, replay, share, and follow for more pharmacy content videos by Miss Jem. See you on my next video.